What is dandruff? Symptoms, causes, diagnosis, treatment, and prevention. Dandruff occurs, essentially, when small bits of dry skin are shed from the scalp. You might spy these flakes in your hair or on your shoulders. Dandruff may make your scalp itchy too. It's a common problem, but it isn't as simple as it seems. Dandruff is actually quite tricky to define because it overlaps with seborrheic dermatitis, a chronic form of eczema, and other skin conditions that lead to a scaly scalp. Here's what you need to know. Signs and symptoms of dandruff. The big tip-off that an individual may have dandruff are the telltale patches of white flakes on the scalp, made up of dead skin, that come loose in your hair. According to the Merck manual, other signs include, at times, the scalp can be itchy, greasy, or dry scales on the scalp, yellowish to reddish scaly raised bumps along the hairline, in severe cases. Causes and risk factors of dandruff. Dandruff can happen for a number of reasons. Seborrheic dermatitis. Seborrheic dermatitis. If you have a particularly bad case of dandruff, it's likely a mild case of seborrheic dermatitis, SD, according to the American Osteopathic College of Dermatology. SD is a chronic form of eczema that impacts areas of the body that secrete the most sebum, or oil, notes the National Eczema Association. People with oily skin are often more prone to dandruff. The reason: a yeast called Malassezia globosa feeds on oils on the scalp. Some people's bodies perceive this breakdown of oil as an irritant, so the scalp reacts by upping the speed at which skin cells renew, causing dandruff, notes Amy McMichael, MD, professor of dermatology and chair of the Department of Dermatology at Wake Forest School of Medicine in Winston-Salem, North Carolina. For those without dandruff, it takes a whole month for new skin cells on the scalp to mature, die, and shed. But for those with dandruff, this process occurs in a mere 2 to 7 days, according to a report. Contact dermatitis. Contact dermatitis is skin irritation caused by either an allergen or an irritant, resulting in an itchy, possibly painful rash. And in the case of dandruff, that reaction is on the scalp. This generally occurs due to hair care products or dyes, according to the American Academy of Dermatology Association. Dry skin. If cold winter air dries out your skin all over, including your scalp, then dry skin may be the cause of your dandruff. When dry skin causes dandruff, the flakes are usually smaller and less oily than the flakes caused by SD, notes PIH Health. In addition, cold and dry climates can also worsen SD, according to the Cleveland Clinic. Shampooing habits. For those who are already at risk for dandruff, washing infrequently can worsen the condition, says Dr. McMichael. Taking extended breaks can lead to a buildup of oil that can lead to dandruff. Age. Dandruff often begins at puberty and peaks around age 20, becoming far less prevalent among folks over 50 years old, according to a review published. Sex androgen hormones, such as testosterone, stimulate activity in the sebaceous glands. More oil means an increased chance of an inflammatory reaction and dandruff. Men are more frequently affected by dandruff than women. Weakened immune system. SD is more prevalent in individuals who've undergone an organ transplant and those with HIV or AIDS, hepatitis C, or alcoholic pancreatitis. For example, 30% to 83% of those with HIV report SD. Oily skin. If you have naturally oily skin, you're at an elevated risk for seborrheic dermatitis. Oiling your scalp. Certain oils applied to the scalp can cover the scale, but worsen the flaking and itching response. History of other skin disorders. Having had eczema, rosacea, psoriasis, or acne can trigger or worsen seborrheic dermatitis. How is dandruff diagnosed? A dermatologist can usually diagnose dandruff simply by looking at your scalp. If your dandruff does not respond to treatment, your healthcare provider may opt to perform a skin biopsy in order to rule out other possible issues, notes the Cleveland Clinic. Duration of dandruff. Dandruff due to seborrheic dermatitis is a chronic condition that warrants repeated or long-term treatment. As for dandruff that arises from contact dermatitis, dry skin, or shampooing habits, changing habits can clear up flakes fairly quickly. Treatment and medication options for dandruff. Dandruff is often a chronic but treatable condition. Treatment options include gentle over-the-counter shampoo. To reduce oil and skin cell buildup, wash hair daily with a gentle shampoo, lightly massaging the scalp to loosen flakes, per the Mayo Clinic. OTC Dandruff Shampoo. If gentle shampoo is not helping, try an over-the-counter, OTC, dandruff shampoo. It's best to alternate between 2 or 3 of these shampoos, notes the American Osteopathic College of Dermatology. For mild to moderate cases, look for dandruff shampoos that contain the following active ingredients. Selenium sulfide. This antifungal slows the death of skin cells. This active ingredient can be found in Head and Shoulders Intensive and Selsun Blue, among other shampoos, notes Northwestern Medicine. Pyrithione zinc. This antibacterial and antifungal combo is in Head and Shoulders, Dermazinc, and Jason Dandruff Relief 2-in-1. Salicylic acid. Neutrogena T/Sal and Baker's P and S both rely on salicylic acid to slough away flakes and promote healthier skin. Ketoconazole. Nizoral AD is a treatment that contains the antifungal ketoconazole. It can be found both OTC and via prescription, and can be formulated as a shampoo, gel, or mousse. Tartar-based shampoos, like Neutrogena T/Gel, act as both an antibiotic and antifungal. But if you have blonde, white, or gray hair, a tar shampoo can cause discoloration. This treatment can also make the scalp extra sensitive to sunlight. Prescription dandruff treatment. If regular and proper use of OTC shampoo, for several weeks, does not alleviate dandruff, ask your dermatologist if you benefit from a prescription-strength antifungal shampoo like Loprox or Nizoral, or a topical corticosteroid lotion, such as Capex or Cinelar, fluocinolone topical, Luxic, betamethasone topical, or Clobex, clobetasol topical. An alternative to corticosteroids for dandruff treatment is a class of drugs called calcineurin inhibitors. These, like Protopic, tacrolimus topical, and Elidel, pimecrolimus topical, work by helping to suppress the immune response, according to Harvard Health. Alternative and complementary therapies. Tea tree oil shampoos or topicals that contain 5% tea tree oil, an antiseptic, antibiotic, and antifungal, appear to be a safe and effective treatment for dandruff, according to a small randomized study in the Journal of the American Academy of Dermatology. Healthy fats. Increasing your intake of omega-3 fatty acids, like those found in salmon, tuna, and mackerel, help regulate oil production on the skin, notes Cedars-Sinai. Additional approaches. Get some sun. Brief bouts of sunshine can help reduce yeast production on the scalp. Right up arrow, but if you are also using a tar-based dandruff treatment, avoid direct sun exposure, as your scalp is especially sensitive to sunlight. Cut back on hair products. Styling gels, sprays, pomades, and more can build up on the hair and scalp, increasing oiliness and dandruff.